Hello, everybody, and welcome to another episode of the Smart Human Podcast. Today, I have the pleasure of chatting with Dr. Joel Warsh, who's an award-winning, board-certified integrative pediatrician. Today, we're going to be chatting about integrative approaches to the first 3 years of life, including nutrition, supplements for kids, environmental toxins, and so much more. So stay tuned. Hello, everybody, and welcome to another episode of the Smart Human Podcast. Today, I have the pleasure of chatting with Dr. Joel Gator Warsh, Dr. Warsh, who is an award-winning board-certified pediatrician specializing in integrative medicine and parenting in Los Angeles, California. He has published research in numerous peer-reviewed medical journals, including the American Journal of Pediatrics and the British Medical Journal, and he's also the author of a recent book, which is just spectacular, called Parenting at Your Child's Pace, The Integrative Pediatrician's Guide to the First 3 Years. I'm thrilled to have Dr. Warsh on the show today to share with us information about a ton of topics, particularly integrative pediatrics, and all the wisdom in his new book. So thank you, Dr. Warsh, for joining us today.
Thanks for having me on, Dr. Cohen. I'm excited to chat.
So I'd like to start off with guests just, so that the audience gets to know you and kind of where you found your footing in terms of the current work that you're doing in integrative pediatrics. Tell me a little bit about what drove you into this area of training.
For me, I would say this. I think a lot of people that go into integrative medicine, they have some sort of life moment where they have a health issue and medical system doesn't help them, or they don't feel like it helps them. They go outside the medical system and they get better. That isn't really my story. Luckily, I've been, knock on wood, pretty healthy. But I just started to see people going outside the medical system and getting better. I met my now wife during residency, and she's pretty holistic minded, so that opened up my eyes a little bit. And I started learning a little bit about functional medicine, integrative medicine, went to some programs and courses, and it really just opened up my eyes to like why are we not thinking about this way? Why are we not learning about these things? And I think that especially as a doctor, you're kind of trained that a lot of integrative medicine, air quotes, is kind of woo-woo and out there. And some of it can be. I mean, there are certainly some things that people go outside of their lane and that can be unsafe. But the reality is there is so much. When it comes to integrative medicine, it's such a big world. There's so many different ways that you can approach it. And realistically, thinking about prevention, thinking about the root cause, thinking about diet, exercise, sleep, these kinds of things, there's nothing woo-woo about it. We just don't really focus that much on it in modern medicine.
Right.
So yeah, it really just opened up my eyes to the reality. This is really important and needed. And I was just really interested in it. And so that's what I've been pursuing more and more. I did all the regular training in Western medicine. I have a Western medicine practice, but it's an integrative practice. We try to blend the best of both worlds together. I'm not against modern medicine. I just think that there are so many opportunities to use these other modalities when it's reasonable and safe. But modern medicine's amazing, and sometimes we need that too.
Yeah, no, I love how you explained it. It's similar to the way I explain it. And, it's giving folks that are listening the idea that it's not one or the other. It's not Western medicine and then this kind of integrative approach. It's what we actually never got in med school. It's the partial training that we sort of received on pharmaceuticals and disease diagnosis through symptoms, but we never kind of pushed to the previous, exposure issues or nutrition issues that may predispose us to disease risk. And as a pediatrician, boy, what could be more valuable and important than our own children and seeing them grow up, healthy. So what was the training for integrative pediatrics as you see it? Like, how did you, actually become an integrative certified pediatrician?
So there really isn't a way to do that, right? Not officially, right? So there are some fellowships that you can do in a couple of places, but that's really for adult medicine. In pediatrics, there doesn't really exist anything specific. I did functional medicine training, so I did a bunch of functional medicine courses. I did an American Academy of Integrative Medicine online program. So that probably is the way that I got certified, I guess. But I think really with integrative medicine, it's self-learning. You learn what you want, you read the books that you want, you learn from other people, and you just keep building. Because integrative medicine, you could be an acupuncturist, you could be into homeopathy, you could be into supplements. There's so many different worlds of what that means. And so I think it's a lot more about interest and what you're passionate about. And so for me, I think it's functional medicine in terms of thinking about root cause and thinking about the foundations of health and prevention. That to me is where I spend a lot of my focus. But there really isn't a lot of training in this, and certainly not in pediatrics. I mean, that's a big hole. Right now, even if you look at like the courses, it's like, well, A4M is a very popular one, and they have like a weekend course you could take on pediatrics, or things, or functional medicine if you want to do the pediatrics things. Like they have one every couple of years for 2 or 3 days. It's not a program. It's not focused on very much. So
And it probably should be, and
it
maybe
should
at
be.
one day, but or as Dr. Andrew Weil says, integrative medicine, functional medicine shouldn't necessarily be outside of medicine training. It shouldn't be a thing outside. It should really be incorporated. But what's the difference, in your opinion, between functional and integrative? Because I like to get certain practitioners' take on that.
Well, to me, I would say integrative medicine is the catch-all term. It's maybe the bigger term that encompasses everything. So I feel like integrative medicine is the most academic term, and maybe the most or the least woo-woo kind of term, and what's used in medicine. Functional medicine to me is one branch of that. Functional medicine is root cause medicine, and to me, that's like one branch of integrative medicine, and you can have all those other things under there. I mean, functional medicine could be integrative medicine could be functional medicine. I mean, the terms are all interchangeable to some degree, but at least for me, I look at integrative medicine as the bigger picture. Like everything is integrative medicine, and one branch of that is modern medicine, one branch is functional, one branch is homeopathy, one branch is
Interesting.
supplements. Like that's the way that I look at it.
Yeah.
Because again, it's like integrative. It integrates everything, which, like you said, I mean, I've said this many times before. The word should just be medicine. It shouldn't be
Right.
integrated medicine. Medicine should be integrated medicine, and a lot of these things should be underneath it. To me,
Yeah. No, I think well said. Yeah. And we all have our slight interpretation based on the training. I mean, some people go all the way fully into functional medicine. Some people fully go into integrative. And a lot of people cross over and do lots of courses for both. But it's this idea that there's more out there to learn than just pharmaceutical, treatments. It's not saying that's not helpful, of course, beneficial and certainly useful and life changing, but it has a lot to do with what pieces were not sort of taught and can be added in. So tell me a little bit about. So you set up your practice in LA. You must see. Look, the reason I didn't go into pediatrics, I'll be honest, is I didn't really want to deal with the parents, right? Because parents can be a lot. I mean, patients, people, I could be a lot, But the idea is that you have to have a certain demeanor, I think, to go into pediatrics. You have to have a certain ability for playfulness, and you have to be able to really be diplomatic and with parents. How have you, sort of navigated that world?
well, I mean, to me, I always loved working with kids. That's what I did when I was younger. I used to coach my brother in baseball and hockey and run summer camps and just loved working with kids. And when I went to medical school, it was to become a pediatrician just because that's what I
Yeah.
enjoyed. And I mean, yes, you have to deal with the parents, but if you're an adult doctor, you're only dealing with the parents. I don't know. I found that it's more fun for me to work with the kids. It's more entertaining at the office. It's they tend to listen a little bit better than the adults do. You can get ahead of things and prevent. One of the big reasons why I got into medicine in the first place was to prevent disease, was to help families when their kids are young, so that way they can avoid, ending up in the office later on. And that I would say also is one of the reasons what really drew me to like integrated medicine and prevention is that's what I feel like we should be doing. I mean, most of medicine now is treatment, which is great. I mean, it's great that we can treat cancer. It's great that we can give you an antibiotic to cure your pneumonia. These are all wonderful things, but with what we are seeing in today's world with the rise in chronic disease, I don't think that modern medicine, the stuff that we learned in the last 10 or 20 years, is extremely applicable to a lot of the problems that we're seeing today. I mean, I do think we need a shift and a transition to incorporate a lot of this other preventative stuff because it's really important. And we really moved from a time where infectious disease was really the big issue, right? People were dying when they were 40. That was the common place, 100 years ago or a couple hundred years ago, whatever it was. And now we do live longer. So we've done a lot of good things in medicine and sanitation and things like that. But at the same time, life expectancy is going back down. Chronic disease rates are going back up. And so this is a big part of health, but not really a big part of our training. And I think the rise has been so fast over the last few decades that medicine hasn't caught up. And I think it's important that we do shift medicine to start incorporating some of this stuff, whatever people are comfortable with. But doctors are good people, right? It's not like doctors don't want to help. It's just that you have to have the training, you have to have the time, and it's not so practical for most doctors to spend
Yeah.
an hour or 2 hours with a patient. Like that's just not part of the system right now, and it's going to take a big movement in medicine to change that, because it really is needed, and it's not a simple transition because doctors don't have the time to spend an hour with each patient. So that means we have to change the model a little bit to.
Yeah, I always say it's not the physicians, really, it's the system. And most doctors going into medicine go in for all the right reasons, they really do, and they just wish a system would support the kind of, history you can get that takes more time than just, 5 minutes. How do you live? What's your stress level? Where do you spend your time? What's your drinking want?
Right.
Had childhood, abuse questions and stress levels, and all of those things are not really set up for the system to pull those answers out so that we can really give good information, I think.
Right. And I think that most doctors would love to, have a practice maybe more like a psychiatrist or something, where you sit down with like 4 patients in a day or 5 patients in a day, and you spend the time and you get to know them and you talk to them for an hour. But if you did that, you'd go out of business in a week or two, right? Like, it's not going to work in the current system. So I believe there is some middle ground there that we could find over the long run if we push, because doctors have the power, right? I mean, we forget. I think that doctors have all the power. You make all the money for insurance companies. You prescribe the things for the patients. So we really have the power to change the system,
Yeah.
but it's going to take a collective effort to say that we've had enough. And that's not an easy thing to do. And I honestly don't think that maybe doctors are even in the best place to be spending that hour or two with patients. I think that the training that we have is so specialized that I think it is good that we're working on treatment and we know these things. I think we need to learn about it, but I think we need to work in teams. There's not enough doctors to spend an hour with every patient. That's not practical in the short term.
Yeah.
But we could team up with a nutritionist. We could team up
Exactly.
with a therapist. We could team up with these other people to spend time. And my dream model for one day would be more like a dentist's office. I mean, the dentists have it perfect. I think they figured it out. Like, the dentist, you go in, right? Who do you see? You see the hygienist, right? And they do your cleaning, they do the talking, they get your x-rays, they do all the things that you need to do. They've set everything up, they've written everything down. You've been there for like 45 minutes, and then the dentist waltzes in for a couple of minutes, checks everything, makes sure everything's fine,
Right.
goes over the serious stuff, and they move on, and they see, a bunch of patients in the hour. But you get your hour. That is something that is possible in medicine too. If it was paid for, you could go into your yearly physical and have your half an hour nutrition consult and your 20-minute, like these things
Right.
could work.
Right.
It could be done, but it has to be paid.
Yeah. No, I think it's a good dream, and we'll see how that plays out. But yes, I mean, a team approach is always going to be, I think more beneficial. And when you talk about chronic diseases, what have you seen in terms of the rise of, say, obesity in young kids, allergies? I mean, when I was a kid, right, we could bring cupcakes to school for our birthday. It was a really big deal. I mean, really big deal. I mean, how, that's got 30, 40 years now. How have things changed in terms of the epidemiology, but also within what you see in your practice?
Well, I think there's two different things. So I think if you're stepping back to epidemiology, because my practice is a little bit unique in that it's integrative practice, so people are a little self-selecting there. But
Yeah.
but in general, everything has gone up. Everything's skyrocketed. Every condition. I mean, obesity rates are insane. It's like 50% of teens, I think, is the number now, are overweight or obese. More than that in adults. Autism rates are 1 in 36, 1 in 22 in California. Mental health concerns are on the rise. Half of all teens have a mental health diagnosis by the time they're 18. Allergies are going up. Eczema is going up. Autoimmune conditions are going up. I mean, the numbers are just scary where we are. And just overall, it's about 50% of kids have a chronic disease of some sort. And that was not the way that it was just a few decades ago. It was like 1 to 5%, depending on what you looked at. And now it's, maybe 40, 50%, depending on which study you look at. It's insane. You have 2 kids and one's going to have a chronic disease. Like, kids are not meant to be sick. Of course, there are genetics and there are factors, and some kids are going to have conditions, but it shouldn't be half. That's not because of our genetics. That's because of the environment.
Yeah. No, and they say even with twin studies, we know that even with twins that there's a, they show that it's not just, our genetics, or else identical twins, which have genetics that are identical, would come out with the same, disease consequences potentially. But we know in twin studies that certainly that there is an environmental component, because it's not 100% 1-to-1 that they both get the same conditions. So, we know environment plays a key role. What I always found interesting, and I'm in Princeton, New Jersey, And I'm very close with, the local pediatricians because I triage a lot of actually rheumatologic conditions because it's very hard to find an integrative rheumatologist, let alone a pediatric integrative rheumatologist. And don't get me started, it's probably five in the
Pediatric
country.
rheumatologist is not even the easiest.
It's incredibly hard, right? Even not even integrative medicine trained. So it's kind of like, you go where you can get some triage. But what I always found interesting, and I chat with them about this, is like we have in New Jersey, at 12 months and 24 months, we have mandatory lead levels, right? I don't know what it is in California, right? So we mandate these kids to get blood draws to look for lead exposure, which is legit, and I get it, and it's important since we took out lead from lead paints in 1978, and there's other forms of lead exposure, but primarily from old paints, old houses, eating paint chips, that kind of thing. I get it, and lead is serious also from water exposure. But what I never understood is why don't we check a panel of just very basic nutritional levels, vitamin D, which is so critical to the immune system, magnesium, whatever, iron levels if they're fatigued, there's just, it seems unusual to me that we don't even focus on that to get ahead of diseases or symptoms. What are your thoughts on that?
Yeah, I mean, I definitely agree with you, in principle on that thought. There's no question about it. I mean, I think the way that medicine approaches a lot of things doesn't make a lot of sense. I think a lot of times it's either based on lawsuits that have happened or based on, covering your butt or whatever it is. I mean, lead is just one metal, right? There's so many. So, if you're going to go and check like lead, you could do a metals panel. Maybe there are other metals that could be, really high in the kid, but lead's not the only one.
Right.
So when it comes to blood work, so here's the kind of the balance there, because I agree with that it does make sense to kind of get ahead of things, but at the same time, blood work is not that fun for kids. And so,
Right, exactly.
and
Yeah,
so
there's no good way to do this. That's the dilemma.
right, so that because parents ask me all the time, and I don't necessarily recommend for young kids to just get blood work just because, if they're having issues, then we would. I think it might be something since we're getting to the point where chronic disease is getting so high that it might not be like a requirement, but maybe it's something where we do start to recommend that we check some basic labs, and so it's not so much, or maybe we can work on getting small amounts of blood, or maybe there's some tests where you can just do. I don't know how it would work, because usually for some of these tests you have to get a full blood draw, but that's not very fun for a 2-year-old. So you know,
Yeah,
maybe it
yeah,
just means that instead of the now recommendations, which are do the general blood work more around like a teen years,
yeah.
maybe for everybody it could be a recommendation if you are interested that you do blood work before you're 5, and maybe you pick the top 5 or 10 things to do, and you just let people decide if they want to do it. But it's not, that's where it's just iffy, because you sending kids to Quest or whatever, they don't have a good time.
Yeah, and I totally understand that. And having 2 kids myself who've needed blood work, it's become, more drama and more a scare over the anticipation than the actual draw itself. But that means, but they're also teenagers. They can voice their opinions, they can voice their fears, we can talk it through, we can rationalize, whatever. But yeah, I just tend to, or at least if they're mandated to get a lead level, they could throw a couple tests. Like to me, it's just sort of a good opportunity. But I get it. It's a system wide problem, but there's no great solution. Let's put it that way.
I
But
think
yeah,
one thing
yeah,
to mention though, because the lead test you can do it in office, right? So that's a thing. So maybe if there was a panel you could do in office or
right,
other things, I don't know. That would be very
yeah,
reasonable, and maybe that's just something that is a bigger discussion for healthcare, of creating a cheaper in-office
yeah.
able, panel where you can get a bunch of things. I don't
Or
I
a
don't know. I don't
or
do
a finger stick or something that's like less invasive or something of that
a
sort. Yeah, I think that would be really interesting because I don't think you need a lot to really understand someone's nutritional makeup. Look, it doesn't go without saying having a healthy, clean diet and working on diet and water and all that doesn't, that goes with what we're talking about. But it's really also understanding sort of the quality of the food system and whether or not, even if people do it right, they're really getting the nutritional levels that they need to be, healthy, I guess. Tell me a little bit about why you decided to write this book about the first 3 years as opposed to all of the years that you manage patients.
So a couple of reasons. Number one, practicality of the book.
Hmm.
Writing a book on all the years is just a lot of information, and so trying to
Yeah.
synthesize it down into something that's more digestible and fun to read. I felt like it's worth to just pick an age range. And to me, the reason why I chose this age range is because I want to get ahead of the issues and conditions.
Hmm.
Most parenting books, basically all the parenting books these days, are written by therapists. They're written by moms. They're not written by healthcare practitioners. They used to be, like Dr. Spock wrote the big books back in the day, and there were a few other ones. But now
Yeah.
it seems like doctors are writing health books. Like if you see a doctor book about kids, it's about coughs and colds and runny noses and that kind of thing,
Yeah.
and not about parenting. But with the chronic disease epidemic, I think that you cannot take health out. But the therapists, as good as their books are, they don't have that training. It's just different. And I thought it's really important to do. And to me, the best touch point in terms of when you can get to a parent, especially a mom, is when she's pregnant, because that's when I think a lot of people read books.
Yeah.
So I figured that this was a perfect time to have a health book where
Yeah.
the health conscious mom or dad or partner, whatever it is, might have an option that's not just one of the general books. It has a little bit of both. So that's why I chose that age range.
Yeah, and actually, I will say, hat tip to you, because I think those first 3 years are such a vulnerable time, and even just calling out those 3 years, there's enough to write a book about. I mean, clearly, there's material there from pre-pregnancy, pregnancy, walking out, which vaccines, what is vitamin K for the baby. All of these are so confusing, and we're not well prepared, as even back when I had kids. So I just thought that was a really nice couple of years that were so critical, especially first-time moms and dads. I think that's really kind of a unique time. But diving into that book, which I find really wonderful, and I wish I had that book when I was a new mom. Tell me a little bit. There's some topics in there that I just love to talk about. Talk about, for instance, tell us a little about skin-to-skin contact and the benefits, because there's things that I think are so anthropologic. They're so evolutionary that you're touching on, and I just wanted to have you share in your own words what your thoughts are.
Yeah, in the book, I tried to go through the big topics that we get asked about all the time, right? And I
Hmm.
think that's an advantage of being a pediatrician over someone like a therapist, because a lot of times they don't get to patients until later. You're looking back at the big questions, but we actually get asked them, right? I get asked these questions all the time in the office and the prenatal visits, and so really I could just kind of run through the questions that people ask and the things that I say. And with skin to skin contact, that's a great, interesting, fantastic change that we've done over the last few years, because we're really just going back to the way that it used to be. I mean, you always just gave birth and you held your baby, right? And then we medicalized everything when it came to birth and pregnancy, which is good and bad. But one of the things that I think was not that great that we did was we over the last few decades kind of started taking babies away from parents, right? We
Mm.
took them into the nurseries, and we kind of had this impression, even I read about it in the book, like this was true of me when I was born. We took the babies to the nursery, and the nurses watched them, and they let mom rest, and that was kind of the theory back then. And even, let's give them formula so mom doesn't have to feed. Like this was the common thing, maybe 50 years ago or so. And what we really are coming to realize through research is that, and just I think intuition, is that our babies are meant to be on us right after birth if we
Yeah.
can. There are just so many benefits to the baby and mom, including for mental health, including for hormone balancing, including getting exposed to the good bacteria that's all over
Yeah.
our skin. So these are things that are just invaluable. Of course, if you need to go to the intensive care unit or something serious is going on, of course, that's different. But whenever possible, the research is pretty clear at this point, and there are not many things that have very clear research when it comes to pediatrics that you should do it almost every time. But this is one of them. I would say this is where we have really, really good data that there's just a ton of benefits and really no negatives. And so basically the research doesn't necessarily grant how long, but what we know for sure is that after the baby's born, if you can hold the baby, and even for a partner, once you've been with mom for a little bit, then it's even good for the partner to hold the baby for a little bit for your own hormones and for the baby too. So I think there's just a lot of good
Yeah.
benefits there.
Yeah, I love that. And I even love the idea about the microbiome, because I find that it very interesting. We all think of the gut microbiome, which, we can talk about later in this topic too for kids, but it's interesting that the skin has its own microbiome, its own, plethora of microbes, bacteria, even viruses, believe it or not. But that's the exposure often, even if a C-section baby, believe it or not, versus vaginal birth, they actually babies swallow some of that vaginal bacteria on the way out, and that seeds them as sort of sterile beings. Their gut is generally sterile when babies are born. And so now they're getting, some of the vaginal canal. If not, then they're also getting maybe some of the skin from from breastfeeding or just touching skin. So it's just all about sort of inoculating this child with, healthy bacteria. But speaking of which, I was just thinking there are cultures now, I think even overseas, that, if you have a C-section baby, I just want to guess this because I'm not sure what your thoughts are, that they take some of the vaginal canal fluids of mom and actually kind of douse the mouth a little bit. I know this may seem gross to some people listening, it was new to me a few years back,
Yeah.
but the idea being that, it helps, inoculate the baby's alimentary canal and gut with the microbes that are so healthy and beneficial.
Yeah, well, I mean, I think it makes sense. I think it makes intuitive sense. I don't know practically if that's the same thing or if there's some benefits or negatives that we don't know. I've seen studies on it and mostly it's positive. So I think the risk is probably pretty minimal given that that's what they would be getting anyways, and you're trying to give them a little bit of what they would have had.
Right.
So I think logically it makes sense. Sounds a little gross maybe, but if you've just given birth or whatever, then there's you're not super worried about that probably at that point. And
Yeah.
there's fluids everywhere. You're not focused on that. So if you can give your baby just a little bit of inoculation of some good bacteria through a
Right.
C-section, I think that's probably a
Yeah,
good.
and I don't think if there's that much pushback from OB-GYNs, but everyone's different. And also you have to keep it away from the eyes. It's actually very important to just sort of keep it in the mouth areas, what I read. So, but yeah, I'm glad to hear that you say that because it does seem very much, it makes sense, right? And in terms of some other kind of gross stuff that I might as well get to, I say gross because, it's not my field. I'm a rheumatologist for adults. I mean, so I don't see this stuff, so, but, there's a lot of talk about placenta. I mean, forgive me, but like encapsulating it, eating it, like drying it out, like what is that all about? Tell me in
Yeah.
this audience, what is that about?
Well, I think it's a fun topic, but it's an interesting discussion because it's pretty new. A bunch of celebrities did it in the last decade or so,
Yeah.
and so that's what made it popular. And the basic concept is you take the placenta after the baby's born, and you get it freeze dried. You put it in generally you get it freeze dried. You put it into little capsules, and then you take those capsules, the pills, over the next month or so, or whatever time frame you want to. And the theory is that it is helpful in terms of your mood, your hormones. Maybe it gives you some nutrients back. So that's kind of the theory behind it. And the research hasn't shown that yet. The research hasn't shown that it's beneficial,
Hmm.
but people swear by it. I've had patients that have done it. Some have said that they didn't find any benefit from it, and some swear that they did. I mean, maybe it's placebo, maybe it's not. I don't know.
Right.
Is there a lot of risk to it? No, probably not. But is there a benefit to it? Should you pay for it? I mean, the research doesn't show that at this point, so I don't think you need to do it. And the reason why this all started was because some other animals do that, right? There's some other animals eat their placenta, but they eat it raw, not freeze dried, not in capsules. So I'm not sure that
Which
trans.
animals? I'm curious.
I don't even know which animals, but I know some other mammals
Yeah.
eat their placentas raw.
Mammals. Okay, that's so interesting. And mammals meaning like I'm wondering if mammals were defined by having a placenta or how that works because we don't have eggs. So,
I have the internet, so let's see.
yeah, right. No, I'm actually kind of interested and curious, like who really does. But I guess the question I also have is like, who does the freeze drying? Like, is that a
There
thing?
are companies that do it.
Interesting.
It says rabbit, buffalo, and cow.
And they're rabbit, buffalo, and cow, so they're all mammals, right? A rabbit is a mammal, of course. So, yeah, it's so fascinating. It's so fascinating.
Anyways, yes. And I just want to say on that. So I don't think the
Yeah.
research bears out that you should do it. I think that there's a lot more research needed because potentially, in my mind, for specific cases, maybe it could be helpful. Maybe for parents that have a history of mental health concerns after pregnancy, or just in general, maybe the the benefits on mood, if it's small, could actually be meaningful for them. Maybe for those that have history of anemia or other nutrient deficiencies, maybe that could be helpful for them. I don't know. So maybe for some subsets, they'll find that it's beneficial. But at least at this point, as far as I've seen, the research doesn't show that there's significant benefit. It's more
Mhm.
placebo. But who knows?
Yeah, no, I think it's interesting. And we may find out that it is actually enormously beneficial. We don't really know. I mean, look, nature has always been right in many, many ways. So we'll see how that works out.
And I made
Um,
that joke too in the book too. I said like, maybe there's a study there to eat it raw. I don't know who wants to volunteer for that, but
right, right.
maybe that is what we should be doing. I don't know.
And also maybe by freeze drying, first of all, there's the possibility of adding contaminants, right? When someone else handles anything, right? But it would be interesting. It certainly doesn't appeal to me. I wanted pancakes after my kid was born, and it's a little different than placenta. So,
Yeah.
but needless to say, I find that keeping our minds open and waiting for the research to kind of bear out whether or not there's benefit, I think is interesting. Tell us a little bit because you go through this in your book so nicely, and that's how I got sort of this list of questions. But, vitamin K shots, what are they needed for? Why do our babies need them? So tell me what you know.
Yeah, so vitamin K, it helps with clotting, in
Mhm.
basic sense. And when you're first born, you don't have a lot of vitamin K, and we oftentimes get it from our food. And you're obviously not eating that much when you're first born, and so there is a risk for vitamin K deficient bleeding in babies. I believe the number used to be about 1 in 10,000 or so. So it's not a super huge risk, but the issue is that if it does happen to your baby, if it's happening in the brain or in the gut, then it's obviously very serious, and oftentimes you wouldn't catch it till it's very late,
Mm,
and it could cause very serious issues. And so they, whoever smart people back in the day figured out that you could give a shot of vitamin K, and that decreases your risk of the bleeding to basically zero, almost to none. And so that's the reason why they started introducing that to really decrease that risk. There also is oral vitamin K. So if you choose not to get the shot, then there is an oral dose, but that doesn't work nearly as well. So it does decrease your risk, but nowhere near the shot, obviously, because you're not getting as much. And so it is offered to everybody in the hospital on the first day to get that shot to decrease that risk. And I would say, if you have a very traumatic birth in terms of needing suction, or there's some big bruising or other things, then that is something that's certainly warranted. It's recommended for everybody to do it. I take care of integrative minded individuals. Oftentimes I get a lot of questions around these kind of things, and the questions are a lot of times like around, do you have to do it? You don't have to do anything, but these are the
right.
recommendations that are recommended by the CDC and the American Academy of Pediatrics. And oftentimes, well, in the hospital, they offer you several things. They'll offer you, all sorts of, several vaccines, whether it's Hep B, the flu shot, now the RSV vaccine. They offer you the vitamin K, the antibiotic eye ointment. So there's a bunch of things that they will do to check the heart. They'll do a genetics screen. So of all of the things that are done in the hospital, if I was going to pick just one, it would probably be vitamin K. I think that
Mm,
has the most benefit for risk ratio. And if you have the one kid that has a brain bleed, that's a really big deal. And this is something that has very minimal risk and a
yeah.
great benefit. And so of all the things that really is offered, I think this has the most benefit to risk. And so, when I have my prenatal interviews, if people are asking me about it, it's something that I do recommend. But if you're not going to do it, I would say at least do the oral vitamin K, because that really has, pretty much no risk, and at least you're getting some benefit there.
Yeah, that's a great answer. And it's interesting. Vitamin K is generally made in our gut by the microbes by our gut microbiome. But if you have a baby who generally, like you said, hasn't eaten, has no microbiome, maybe a C-section, which definitely means they really didn't start off with that big gulp of bacteria for whatever reason that mom needed C-section, of course. Then vitamin K is something that we normally would have, but just don't have enough at birth. So, yeah, I think that's just important for people not to be afraid of something like that. I would agree with you. I think that's a pretty important way to start your life, especially if you can't find a bleed or, God forbid, there's something just so low level. Tell me a little bit about cord clamping, delayed cord clamping. It's another thing I didn't know because I'm old and I've got teenage boys. This is not something that we even knew about, or at least I didn't back in the day. So what is delayed cord clamping?
So, okay, so what it is really, so when after you give birth, then, if you're watching the videos or you've ever had a baby, you get in there, they clamp off the cord, and then somebody cuts it, usually the dad or the partner. And so delayed cord clamping just means you're waiting a little bit longer to do it. And the theory would be that you're transferring things from the placenta to the baby. So the longer you wait, the more that's getting transferred, the blood that's getting into the baby, and everything else in there. So this is one of those topics that I think is really interesting, because it's moved from the woo-woo to the very mainstream. The research and data are pretty unanimous at this point that it is helpful to wait a little bit. So there's no reason reason to rush, because I think in medicine, we're like, oh, let's get in, let's get out, let's get this done. I didn't move to the next patient. We've had our baby. I have another patient to see. And so, the doctors were like, all right, let's clamp it, let's cut it, let's get out of here. And that I would say, it does make sense that we don't need to rush, and we can let
What are the benefits? Why would you wait? And how long would you wait?
So that's the next part. So that's the part that's not consistent. Everybody has a different opinion on how long to wait. The benefits are that you're giving more time for the transfer of the nutrients from the placenta to the baby. So you're giving them more blood, which means they're getting more iron and more of everything that's in there, as opposed to cutting it off. So basically everything is unanimous that it should be like 1 to 2 minutes. So pretty much all OBs, they just do that now. They just don't cut it right away. They just, a minute or 2 minutes, not very long. So they just don't rush to do it. And they're not like delayed cord clamping. They're just not doing it for in 15 seconds after you give birth. They're waiting a minute or two, and then you do it. They're taking their time. But
are there studies to show that there's a higher iron rate with the longer you wait? So it's not like you would go 10 hours. You just basically trying to make it, because then there's clotting related issues, I think, the longer you wait, right?
The longer you wait, it's more the jaundice issues. That's the biggest concern. So the more blood that you have, the more risk for jaundice, because there's more red blood cell breakdown. But that has been noted to be an increased risk, but not extremely significant, and something that we monitor. So the risk is very low. So the benefit to risk is actually pretty good there. But the debate is on how long, because some people say 1 minute, some people say 2 minutes, some people say 4 minutes. We're not talking hours, we're talking minutes.
Right.
But if you wait 2 to 5 minutes, that's plenty. I think 2 minutes is totally fine. So you can just very simply say to your OB, like, oh, I know about delayed cord clamping. Can you just be cognizant not to clamp it right away, wait a minute or two before we do it? And they probably do it anyways at this point. But if you ask them to wait a little longer, then they just will.
Yeah, I love that. And a lot of this does come down to your relationship with your OB-GYN and choosing someone that you feel comfortable having these conversations with. And I think people should. I mean, do you agree? I mean, you're the pediatrician, you're not delivering,
right?
But is your experience that relationship is quite important?
It is. And I think discussing it before is really helpful, so that they kind of know your plan going in. Of course, you can't be too dogmatic about your plan, because whatever your plan is, the world doesn't always go in that direction. Right. But I think it is very useful when you're going in to say something like, I've read the research and it looks pretty clear that delayed cord clamping is great. Would you mind waiting 2 minutes before you clamp the cord? And I mean, 2 minutes is not very long. They'll do it. That's not going to be an issue. If you're like, can you wait 3 hours? Then they're probably not going to be that happy.
Then there's going to be maybe
then you have a discussion. But I don't think that there's any research to show that going longer is better in terms of hours or even 30 minutes or anything.
No, and again, like having your book and looking through it, I'm discovering, I'm not going to have any more kids. It's probably not going to be possible, nor did I want them. But the idea is that I have people to talk to who want to become pregnant. And there's always these touch points of family and friends and having grandkids eventually. And I just think that having a blueprint, and even learning these from your book was something that's updated. I haven't heard a lot of these things. It's very new. So it's kind of a nice twist on your planning for people to know these things.
That's one of the big goals, right? I mean, one big goal was to, obviously focus on health. We talked about that already. The other big goal was to help parents to decrease stress. And the way that I think that we can do that is by being prepared and understanding how to synthesize information, because there's so much information out there these days, and it's hard to know, what to trust or what you should do. But I feel like where I can be really helpful is not to tell you what to do. I mean, I think that's my general philosophy on medicine, is not to tell you what to do, but to provide information, provide the different possibilities, let you know what's going to come up in your pregnancy or in the first year of life, let you know the different opinions that are out there and the research that's available, and then hopefully that can help you make a decision that's right for you. But if you don't even know about cord clamping, you don't know to ask, right? So you have to kind of know the information out there, and if you know that there's a lot of good research and data that says that we should support it, then I think that most people will feel comfortable asking their OB, because they're not going to sound woo-woo. They're going to be like, well, I read this, it's got a good research, and their OB's like, yeah, that's fine.
Right. No, I totally agree. And so being prepared is half the battle of decreasing stress. And so kudos to having these topics in your book. So I want to move on to toddlers. I have a bunch of questions, but before I get into that, I want to kind of ask you about the seeds of well-being, because I particularly was excited about this acronym and how you frame sort of the philosophy of, integrative approaches for young kids. But really one of them is environmental, which really got me excited. So tell me a little bit about how you came up with this acronym and what it stands for.
And so to me, this is really the heart of the book. I mean, this is the heart of my philosophy in general and things that I talk about, because I wanted to start by talking about the foundations of health. And these to me are the foundations: stress, environment and toxins, exercise, diet, and sleep. I mean, there's some other things too, like getting out in nature and family time and love. But the core really, I mean, the core two things to me are diet and toxins. And we just don't focus on these things enough these days. And to me, unfortunately, we don't exactly know what's going on with the chronic disease epidemic, but I strongly believe that the vast majority of it has to do with the fact that our food is so crappy that we're not getting the nutrients that we need, and we're exposed to so many chemicals and toxins that they're just too much for young bodies or adults, and at some point it falls over the cliff and expresses itself as whatever condition, whether it's a mental health condition, whether it's ADHD, autism, autoimmune, whatever. Your genetics certainly plays a role in your susceptibility, and for some people it's totally genetics, but I think for the most part it's not totally genetics. I think it's the mixture, and I believe that our environment is so toxic at this point to young bodies that we're just not able to handle that load anymore, and it expresses itself, and that is the biggest factor behind the chronic disease epidemic that we're seeing, and also why when people change their lifestyle and change what they're doing, they oftentimes get better. Not always, but often, right? If you can figure out the big triggers, then we see things turn around. We see diagnoses that people were told that they were going to have for life. The lab numbers get better. They lose their diagnoses. The symptoms improve. So nobody can ever convince me based on that point alone that it's genetics. It's not genetics, it's environment. And we have so much power, which I think is empowering. I think it's so important to think in that way, because you just say it's genetics and you're like, oh, whatever, it's just your genetics. I guess that's how it's going to be. I'm going to have autoimmune condition, but if you're like, well, maybe there are things that I could do. Maybe something's contributing. Maybe something's in my home. Maybe there's a lead exposure, a mold exposure. I don't know, whatever. Let's dive into this. Let's be a detective. Let's do what we can. Let's take our power back.
Yeah.
People that do that, they often get better.
Yeah. And even psychologically, when you are in control, when you don't feel like you're the victim of illness and you sort of are in control of, as much as you can be, of your health prognosis, there's some sort of self-healing. There's a sort of a positive propagation of good stuff ahead. But I love that because it covers integrative medicine, and I love the SEEDS acronym. So, and in terms of what you share with patients about, like, what are some of the top environmental recommendations or top sleep, or, break it down into some of your top usable practical recommendations.
One of the big things, I mean, that's such a useful thing that you said there is usable, because that's the way that I always try to frame things, is really focus on what we actually can do, because it can be so overwhelming, and it's really easy to say, the whole world's toxic, there's nothing I can do, it doesn't matter. And that's not true. It makes a huge difference, and every little bit matters. And so I don't think that parents should feel overwhelmed. I think wherever you are, the first step is to just be mindful. Just be mindful of everything that you purchase. Read the label on everything. Start to learn about whatever you can that has to do with health and the ingredients. And that will start to move the needle in a positive direction. If that means you're buying a bag of chips, doesn't have to mean you have to buy broccoli, but you can look at the 2 bags of chips and pick the one with better ingredients. And that moves things forward. And every little bit adds up. Start where there are big things that you do often, like in your home. You're in your home a lot. So what can I do at home that can move the needle a little bit? Well, we breathe a lot, right? Breathe a lot of times a minute. So maybe you could work on the air. You can't change the air in the world. I guess you can go lobby Congress if you want to, but most people aren't doing that. So let's focus on our home. And you can do things. You can get more plants that clean the air. You can get an air filter. I mean, these are pretty simple things you could do to just improve the air a little bit. You could, you drink water. If you're drinking water from your tap and you're in a city that doesn't have great drinking water in the tap, then you can get a filter.
How does this affect children the most? Like, for instance, when we talk about sort of adult exposures versus pediatric exposures, you mentioned a little bit about how the fact that they can't detox as well. Yeah, tell me a little bit about because they breathe more than adults. I mean, give us this sort of, kids get more of everything, really, just because of their physiology.
Yeah, well, I mean, it's interesting because I think on one hand, kids are a little more resilient, but on the other
Mm,
hand, they're not fully developed. And so, a lot of our detoxification comes from, well, three main ways, peeing, pooping, and sweating, right? And so, younger kids in general not sweating as much. I mean, we should get them moving, but they're not, and that's something we can easily do, especially as they get older, is make sure that they're
mhm.
moving, and that's a whole other topic of exercise and moving. But that's a big part of getting things out. We
Yeah.
don't drink enough fluids at this point. So again, just drinking a lot of water or drinking a lot of fluids helps you pee more, helps you get things out. And we don't eat the best food anymore, so we don't poop as much as we used to. I mean, a lot of native tribes are pooping many, many times a day, and we maybe go once a day or once every couple of days. So things are building up in us a little bit more. But even
Is
with,
that because our fiber intake is pretty low comparatively to other
I think
cultures?
that's probably part of it, and I think we're just not eating real food, and we're eating
Hmm.
food that's tough to digest, so our gut's always inflamed and things don't move as fast. But yeah, if you look at a lot of the native tribes, they're going all day, and that's not true in our society,
Yeah.
and so and to your first part of that question, like, their livers are not fully formed, their kidneys not fully formed, so you're just not getting things out at the same level that you are for adults, and then their body ratios are a little bit different. They're smaller, so there's a lot of factors to it. But at the end of the day, I don't think any of those like nitty gritty details really matter. I think it's because this is a problem for everybody. I think we're just getting too many chemicals and toxins for whatever age we are, and so it's just overflowing at some point, and we're just seeing it younger and younger because we're just exposed to it, yeah, go ahead.
Oh, no, no, no. I think you're doing great. I'm sorry. I didn't mean to cut you
No,
off.
no,
I was
man.
also,
I was just
I
like,
was think, yeah. I mean, going into, I was just kind of thinking about some other rises in, say, autism, and there's a big argument. It's not really as strong anymore about vaccines contributing, but again, that's a big topic for another time. But in utero exposure, even as a pregnant mom in an environment that may, and it's not to blame, it's not to in any way give moms any grief at all, but it's really thinking also about that toxic load and at which stages during development, and that in utero exposure versus even when a child comes out and has still undeveloped detox mechanisms. It's just, what are your thoughts on when I mean, obviously parents are worried about autism even in with no family history, so what do you tell those folks?
yeah. I mean, autism's such a frustrating conversation because of anything, it's gotten the most pushback in terms of genetics and better diagnosis, and it's like it's
Mm,
so ridiculous. Like, yes, we are better at diagnosis, there is no question, but we haven't changed the criteria that much in the last 20 years, and we certainly can't. I don't know how you can attribute going from 1 in 25,000 to 1 in 1,000 to 1 in 250 to 1 in 150 to 1 in 30, or whatever the numbers are at this point. It's like it's such a huge rise. Certainly, it's a huge 1 in 150 to 1 in 22 over the last 20 years. Like, that's not because we're better at diagnosing. A little bit is, of course, we're more aware of it. People are seeking out care more. Yes, okay, that's a part of it, but that's not what's going on. You can go back in time when we were growing up and you did not see it very often, and 20-30% of kids that have severe autism, which means they're nonverbal. And where were those 20-30% of kids that were nonverbal 20-30 years ago? Like, that wouldn't be missed. Maybe they have a different diagnosis, but that would be something. So it didn't exist. It wasn't there. It's happening now. It's to do with our environment. Not all of autism, certainly genetics are involved,
mhm.
but something is going on, probably many things, and it is contributing to what we call autism. Autism is not in any way at this point a genetic diagnosis. I mean, there's a lot of genes through the latest research that have some correlation with autism. So I think there will find over time a genetic makeup that makes you more susceptible. But we are seeing this because of our environment and our toxins. I don't think there's any question in my mind. There's no question in my mind at this point that that's what's going on. And I don't know why it's so controversial, because I take diabetes as the perfect example of the way that we should be thinking about these things. Autism, we don't have a specific test to say that you have this or don't have it. It's
Mm,
more you're getting
right.
evaluated. And with diabetes, you have type 1 and type 2. And you have type 1, more genetic, the way that it is. And type 2, it's more lifestyle, right? And we were very okay in modern medicine being like, well, you need to change up your diet, you need to change up your exercise. If you do this, then your diabetes is, going to improve if you have type 2 diabetes, and maybe you're not going to have the diagnosis anymore. I think that most conditions are like that. I think we have to break it down by type 1 and type 2. And I think something like autism would do really, really well if we broke it down by type 1 autism and type 2 autism. And, maybe there's some autism that's totally genetic, and then maybe there's other autism that's totally lifestyle or some mix in between. And I think if
Yeah.
parents were empowered to think that way, then we would start to figure out what are the big triggers, and we would start to turn the needle. Because I have worked with kids and other practitioners have worked with kids that had the diagnosis of autism, changed up their lifestyle, and their symptoms went away. They lost their diagnosis, they improved significantly. So even if let's say can't get rid of the diagnosis, you can still improve their life considerably. You can help with their symptoms, you can help them function better, to whatever that means for each family. And that's not controversial. Like, there's nothing
Yeah.
controversial about helping a kid function their best.
Yeah, I agree with you. I think that, I guess the root of that is that we have much more control over our health, whether it's autism, whether it's obesity, whether it's allergies. And again, not for everybody. I don't want to make a blanket statement because, again, genetics are involved, but certainly lifestyle and environmental exposure, all that play a big role. Certainly in the numbers changing, I agree with you. And then it opens the door for intervention, which is what you're supplying and what you're writing about. And, a lot of people are doing. So I just think, I just wanted to kind of mention that real quick because, people are looking for answers and they're looking for things to do. And I think one of the best ways, no matter what your child, if they're healthy, fabulous, that's wonderful. If you're trying to manage any kind of acute or chronic illness, is, just thinking about very basic things that you described: drinking water quality, food quality, exercise, nature, and also that in utero exposure even before you get going with pregnancy. If you can plan it, of course. So let's talk about some other kind of fun topics. So colic in babies. What do you tell, we all know about colic since, generations. What is colic? What do you recommend from an integrative medicine approach?
And so, colic is really just crying with no other good reason for it for a good amount of time. So there's different definitions of it, but usually it's like 3 hours of crying every day, or for a couple days in a row, or maybe for a couple weeks. So it's just more crying than we would expect. Kind of. There's not a great definition really, and what really helps parents is really to understand what's normal versus abnormal. And I think parents don't have that expectation. And if you consider that 3 hours of crying, if you take that definition, per day is normal, then even after 3 hours, as long as everything else is healthy and normal, you just call it colic because we want to have a diagnosis for something so parents can have a name for it. And then that's still normal, technically. So you don't necessarily have to do anything about it, but I do talk to my parents that, maybe there are some things contributing to it. We definitely, in general, feel like it's more of a gut issue for a lot of babies. So maybe there are
Yeah.
some things that we can do to help the gut, to help calm them a little bit better. Maybe they have some reflux, whatever it is. I mean, it depends on the baby, but I usually start with the gut. There are good, like gripe water, natural remedies that you could try to help calm the gut. There's probiotics that you could do. Sometimes reflex precautions, helping them stay upright a little bit more, can be helpful. A lot of parents with colic find a lot of benefit from going to alternative practitioners. So acupressure could be really good, or cranial sacral therapy, or even chiropractors that work with babies. Chiropractors is a very interesting one. Because people, if you grew up in our generation, like, you're like, oh, chiropractors, they crack backs, whatever. But that's not what they do with babies. And chiropractic is a very interesting field that's pretty wide ranging at this point. And there are some really good ones that work with kids, and they do gentle adjustments. I would say if you're thinking about it more like acupressure, so kind of just pressure points and helping it. And it seems to be really helpful for parents. I don't know if it's placebo or what, but the amount of parents that have had a colicky baby that went and did one of those things, and then a couple days later they said, oh, it was so much better. They had a big poop. Oh, they seem, so I don't know. Well, what do I know, right? I think that it's worthwhile if you have a really colicky baby to give these things a try. There's really no risk to most of them.
Yeah, and I always thought colic was specific to the gut issues, but I think I'm wrong. It's really more defined by the crying and maybe associated with some stomach or gut issues. And you said acupressure, which I think maybe some of my audience doesn't know is not acupuncture, which involves the needles, which by the way are not painful, but acupressure involves no needles. It's touch.
Correct. Yeah, so a
Yeah,
lot of acupuncturists that work with kids generally do acupressure because obviously
yeah,
kids don't love needles.
right,
So they do this similar thing but with their finger, or they use tools that don't puncture the skin but kind of put the pressure on those
right,
places. Like imagine like a pen, you put pressure with a pen
right.
on this area. So they're using the Chinese medicine pressure points, acupuncture points, and I'm not a Eastern medicine practitioner, but I mean this stuff's been around a lot longer than modern medicine, and there's a lot to it. So I think that before you assume that it's all woo woo, let's keep in mind where we went with acupuncture.
Yeah, it's like
All of a sudden.
3,000 years old. Right,
All of
exactly.
a sudden, there you have an opioid epidemic, and nobody wants to give opioids anymore, and you need something, and then acupuncture is in every single hospital, pretty much for pain, and it works miracles. So I think that we're we're just starting to realize some of the benefits of some of these things, and I think it's really important to not throw everything out just because it's alternative. I think there's a lot that we can learn from these other cultures that have been doing things for thousands of years that have found benefit. It just, I think, matters the practitioner you work with.
Yeah, great, great. Well said. Tell me a little bit about vitamin D supplementation in, toddlers, or what are your recommendations? Let's just assume parents are doing the best they can with the nutritional components and maybe even water filters, whatever, wherever they are. Are there some hard and fast supplements that you feel that every child should be on, should be evaluated for, or do you leave that to a later age?
So, okay, so a couple of things there. So, my personal opinion on supplementation is nobody should be on things just because. I think that we should be getting our nutrients from food and from the environment, and that should be the baseline. Now, so many kids are deficient these days that it's not unreasonable to do a multivitamin. It's not unreasonable to do vitamin D, especially if you've had your levels tested and it's low. The American Academy of Pediatrics recommends vitamin D for all babies, but even for me, I think that's a problem because that means our babies are deficient. They should be getting it from the sunlight, and we're not getting enough sunlight. So, to me, I recommend if you can, get outside, go for more walks, especially if you live somewhere with sun, go early morning, late afternoon, sit by the window, sit under a tree, like try to get your vitamin D from the sun. If you want to do a little supplementation, I think that's totally fine. If you live in a location where it's winter, you can't get outside as much, you're not getting a lot of vitamin D, that's probably reasonable to do it at that point. But I think the messaging is not great in my mind. I think we need to be messaging that we should be getting this stuff from food, and because we're not, then you can supplement, but we need to focus on getting it from our environment. So that's my greater kind of message there. But if you're giving a kid a multivitamin, is that a problem? No, there's not a big risk there. And I think that's reasonable if they're deficient. And vitamin D is the biggest deficiency that we see. Basically, everybody's deficient these days. So if you're going to do something, I mean, there's pretty low risk there. But my solution is not to give vitamin D, it's to get more vitamin D. And if you can
Yeah.
do it from the sun, that's my preference.
Yeah, I love it. Okay, so also, when do you worry about a newborn? Like, I love that section of your book because, I remember having worries with newborns, and I really felt lost, and I didn't really know who to call or to talk to. So,
Yeah.
tell me what you laid it out very nicely.
Yeah, well, I think, of course, if you have a newborn, you should have a little bit heightened level of concern for just anything, as do pediatricians. We do. If you're ever super worried about anything, of course, feel comfortable calling us or go get checked. There's no, you got to trust your intuition. But for sure, you want to be worried if a newborn has a fever. So above 100.4 in a baby under 2 months, that's something you got to get checked right away. Breathing is a huge part of the newborn time when doctors are very worried. So any worries about breathing, that's something you want to get checked. Just keep in mind that babies have periodic breathing, so it's pretty common, especially if they're sleeping. They might take a couple of breaths, then have a little pause, and then go back to breathing normally. That's not concerning breathing. Concerning breathing would be faster and faster breathing in the setting you're worried they're sick, they're breathing really hard, they're belly breathing. That you always want to get evaluated. Not feeding, so dehydration would be a big concern, bleeding, or crying unconsolably. So something that's way outside of normal. It's not stopping. You can't comfort them. So you're worried that there's something going on inside. They've gotten hurt. They fell. Something like that. That would be something you'd want to get checked. So those are the biggies, I think.
Yeah, those are pretty good ones. And I think gut instinct for most parents is that if you feel concerned, then there's reason to follow it through. But you really never know. And, in terms of SIDS, which I actually don't recall what the acronym stands for, I'm not sure if you do, but it's when a child,
Sudden infant death syndrome.
Thank you. Sudden, I'm too old for these acronyms. But I guess the question is, that's has been really something that's decreased over the decades because we've learned so much about it and how to, keep a baby on their back, not on their front. Tell us a little bit about what you've seen. Have you seen any cases, God forbid, but also, are the recommendations being followed through and people are really succeeding at that?
Yeah. So, I mean, first of all, sudden infant death syndrome, it really is what it's called. We don't know why babies die from sudden infant death syndrome. What we do know is how to decrease it. Like you said, by Back to Sleep has been the campaign that has really helped decrease it significantly. I don't believe I've seen a case in my practice. I have heard of it. I've heard patients that have had family members that it's happened to, and I've certainly seen it in the hospital. Kids rush to the emergency room and things like that, unfortunately. But it has greatly decreased, and the vast majority of the issues today are in children whose parents are under the influence, so taking a sedative medication, drinking, taking drugs, and then kind of falling into a weird position where they can't breathe. I think that's really the biggest.
With the baby in the bed or on the
Yeah,
couch
with the
is what
baby
you're
in the
saying.
bed,
Yeah.
or
Yeah.
like, the biggest risk is really on a soft surface, like on a couch. So you're holding them, you kind of fall asleep, they fall into a weird position, and they can't move. So
Yeah.
so that's a big one for them.
Sure. Yeah, absolutely. And two quickies because I know I could have you here all day long. I have a million questions, but we have to get you back to seeing patients. So tell me a little bit about. So, well, first of all, honey for kids under one. Why is that an issue to give honey to children under 1 year of age?
So there's a very, very, very tiny risk of botulism from honey. And so the recommendations are to wait till after one, just because the gut's a little bit stronger and better to handle the botulism toxin. It's an interesting one because it's actually kind of debated a little bit now, I would say. It was pretty common sense to not do it, but now most people think that the botulism really just comes from construction sites. You live near that and there's botulism in the soil, and then you breathe it in.
Huh. That's
That,
something I wouldn't have thought of.
Yeah, so I think a lot of it comes from just breathing it in versus honey, from what I had seen over the years, and even we were learning about that in residency. I remember, but still the recommendation is not to do it from honey until after one. Which I mean, you can wait till after one for honey. It's not the biggest
And
deal.
most honey isn't even actually 100% honey in this country. I mean, maybe if you get USDA organic, but there's so much watering down. I mean, that's a separate issue. But I'm just saying it's kind of interesting the sourcing of even honey. But
Well,
but botulism, yeah,
and I've had plenty of patients that have accidentally given their baby honey.
yeah.
And then they'll call in after and be like, "Oh my God, grandma gave them honey and they didn't realize, or I didn't realize there was honey in this thing." And never once have any of them got botulism. I've seen botulism in the hospital. Who knows how they got it? Sometimes they think honey, sometimes not. But I've never actually seen a baby who ate honey get botulism. So I think, at least on the parents' concern, when somebody eats it, I try to calm them down
Right.
and say, like, look, you need to be aware. Here's the symptoms to watch for. We'll watch over the next month or two, make sure this doesn't develop. But basically, the risk is almost zero, so don't worry too much. It's just that it's not zero, so we have to watch for it.
And it's more likely to get botulism from a dented can, maybe with food that's in. Remember, because that's the whole
Right.
concept of why you don't want to eat foods that are dented. And my dog food had a dent, and it was horrible what looked inside, and I didn't even want to test it. But the idea of why we actually have even a potential liner inside of cans, not that I'm agreeable with BPA and bisphenol A, but there is a reason why to prevent the botulism, which is now botulism is also Botox. I mean, right? Botox is what a lot of people are getting injected, but it's not what we're talking about when it comes to infection in a baby. That's much more serious. Okay, one other question. So I signed up for your Substack, so I wanted to read more about what you had to say. So Dr. Gator at substack.com, and I got in the email a little monograph about lice, and I thought it was really smart because you were saying that the American Academy of Pediatrics basically just changed their philosophy about kids in school who have been found to have lice and not sending them home. Like, just wait out the rest of the day and then send them home whenever they're ready to go home. And you had some some strong thoughts about it, and I kind of wanted to hear you share it with this audience.
Yeah, I think it's a very weird, interesting way that they've gone with that. I mean, I don't know who thinks that it makes sense to leave a child with lice in school. I think if you identify that they have a condition which lice, can pass from kid to kid for sure, then why would we not send them home? I mean, I don't think it's like an urgent emergency thing, but their reasoning is that it's not an infectious disease. They're not gonna, like, maybe the other kids will get it, but it's not something that they couldn't be doesn't transmit like an infectious disease that's really serious or anything like that, which I think is still a little bit weird. I mean, I think we want to be minimizing the risk to other kids. And I think that most parents in a school would appreciate if one of the other kids had lice if they
Right.
were treated before being back. I know that I would. I would not, and I would not want my child to be there. Like, if it was my child and the teacher found lice, I wouldn't want to find out that they were like, oh, well, we found it this morning, but we didn't let you know. And they were all playing together and sharing hats today. And like,
Right.
I don't know. I just think that's a little bit, I mean, maybe they could soften it a little bit to say like, well, we're not overly concerned and there's no urgent need to send them home, but we still would recommend sending them home as soon as it's found. Like that to me is the correct wording where we don't want to like shame a kid or shame a family, but there's no shame really in like having
Right.
lice. You get it from wherever, you got it from somebody else. So I think it's
Right.
more about protecting the other kids. And
Yeah.
also for you, like you want to get it treated like I would if I found lice, I would want to get it treated right away because it's going to get worse, right? So I
Yeah.
would want to like stop whatever I'm doing and go take my kid to a lice place so we can treat
Yeah.
it.
Yeah.
So I think
It's interesting how that recommendation came out. I mean, that seems like it go against common sense.
that's what
And
I
even
thought.
sending your kid back with knit free, like you have to guarantee it. Like, it's like, wouldn't you think that would be just appropriate for the rest of the classmates? But
Yeah.
I love your Substack. I thought it was very thoughtful and very, it made a lot of sense. So if people listening would like to, get more information, which brings me to the end of this podcast, unfortunately. And I wanted to ask, how do people get in touch with you? And, how can they find your beautiful book, which I'm going to hold up. Again, it's called Parenting at Your Child's Pace, The Integrative Pediatrician's Guide to the First 3 Years by Dr. Joel Warsh, who is an integrative pediatrician. So thank you also for being here. But tell us, how can people reach you?
So the best place would be Instagram or X at Dr. Joel Gator. You can find Parenting at Your Child's Pace wherever, books are sold, Amazon, all the regular places, or parentingatyourchildspace.com. And I want to finish by thanking you for what you do. I mean, there just really are almost no integrative practitioners that do what you do. So it's pretty
Oh,
amazing that you are doing that. And then I hope that you can rally up more colleagues to do something similar. Because I mean, I know you know this, but there's really very little woo woo that we do. It's not
yeah.
about that. It's about just kind of pushing back and focusing on some basic stuff. And you focus on toxins, and that's a huge thing. I mean, that's what needs to change, and hopefully we'll be able to fight back against the big companies. But it's an uphill battle.
Yeah, no, and I appreciate, colleagues like yourself, which is why I love that you're doing what you're doing and sharing in your book form and your Substack and really having an eye on this, because our training teaches us about environmental health and integrative medicine training. But it takes a village. I mean, it's not going to be one voice that's going to change the world necessarily. I mean, it might, move a little bit, Margaret Mead, but it's not necessarily going to be as fast as we need it in certain terms of our illness issues. But I'll tell you, I love what you wrote. I continue to like what you write about, and you have all different other avenues for people to learn from you, which I encourage people. And we'll have a lot of links on our podcast page. But again, I want to thank you so much for the work you do, for sharing your knowledge, for being so open-minded, for having such an even-handed approach to the topics that are so scary for so many people, including new parents. So thank you again for being with us. And we'll be sure to pass this interview around so that people can hear all of your wisdom.
Thank you.